All right, this is the Stryker Altrix. This is going to be for our hyperthermia and hypothermia patients for our cooling and heating blankets. This is kept in soft. It's going to be, everything's laid out so I can show you, but back there it's going to be put away, wrapped up. Make sure when you grab it, you're going to grab one of the cooling blankets. There's two types. We also still have some for the Gaymar. There's different connectors for the Gaymar. These ones are both going to be the same male. They look the exact same, the two males, and the Gaymar, one of them has like a hook and they're different sizes, so make sure you grab the right blanket. You're also going to want to grab either a temp sensing Foley or a rectal tube. These are kept across from room 22 and 23, and these are kept, the rectal tubes are kept in room 8. Also, you're going to need to grab the monitoring equipment to plug into the Drager, and then all the wiring that goes for the temperature systems. So it should already, if it's not already filled with water, then you're going to fill it up with 1 gallon of distilled water. But if it already has water in it, I'm going to leave it for you guys to mess around with it. You can play with it in soft. It'll have water. You don't need to worry about filling it up. To turn it on, you're going to plug it in. Everything when you touch on here, it takes a little bit longer than you think it will. So give it like a second or two for a delay. So once it's on, if you're attached to the patient, I have a fake patient here with like some warm water. So there's two modes. In manual mode, you do not need any sensor, so you can just get it going on a patient and then work on getting in the rectal tube or temperature sensing Foley. You're just gonna set what you want the temperature of the water to be. Since I've already been running it, it's 22.5, so we can set it whatever we want to set it at, hit confirm. It's going to start rolling. You can see in here that the water is going through. It comes through one, it comes back through the other, and it'll get all the air out eventually. It takes a little bit to do that. If you want to change, let's say you're on manual mode and then we want to get back to automatic, we're going to go to edit. We're going to be in automatic mode. We see that our temperature of our patient is 36.7. Let's say we want to get it down to 35. We're always going to check with our doctor what we want to set our target temperature at. This is obviously in Celsius. After we have our number, what we are studying it at, go ahead and hit next. We're always going to be on max cooling and hit confirm. And this is going to work the same way, but now it has a smart mode that's going to not cool the patient too much. I don't know why oh, there, now it's working. Okay, so right now it says our patient is 36.7 degrees, and we can also see it on the Drager because we have a couple different connectors back here. This one right here, and it says it on here, it says 2 patient, 2 Drager. You plug this in right here, and this is gonna go to either your rectal tube or your Foley, temp sensing Foley. So we all know these little like connectors, that's what it's gonna connect onto. This one, the white one, because if you can have both temp sensing Foley and rectal, it does recommend that, you don't need to, but that's why there's 2 of these. This one goes in the B, and this would go like to the temp sensing Foley. It's not for 2 people, it's only for 1 person. So this one that goes to the Drager is gonna plug into our extension that we normally have that plugs in here. And so you can have it on the Drager, see it, and pull it into Epic. So that's pretty much it of all the connectors. Oh, look right here. For some reason, there's 3 of these tubing things, and there's 1, 2, and 3. They're in the back here. Let's do that again, sorry. 1, 2, and 3. We're most of the time just going to use 1, so we could just leave 1 put up so it's not confusing. And then we're in the A temp sensing right here. You can see that on the front that we're in the A temp sensing and we're using 1. If you have multiple plugged in, then it will show other ones here, but let's just leave it like this, nice and easy. So again, it shows what our temperature is of our patient, what our target temperature is. There's a couple different, these buttons you can kind of see like how long they've been going, how quickly they've lost their temperature or raised it, and this shows like what everything's set at, your parameters. I believe that's pretty much all you need to know on this. After you're done, these are disposable, just go ahead and throw that away. You're supposed to clean this out, drain out the water, and like flush it through with some, there's a little thing here back here that opens. There are some chlorine tabs So if you're able to, or if you want a tech to do it, if you're able to, there's directions that are online and links how to do that. I think that's it. If you guys have any questions, you can email myself or anyone else in the education committee and go play with it as much as you can back in soft, especially because the buttons, you really want to touch it because sometimes it takes a little bit longer, and it's like old people with an iPhone, how they push it really hard. You gotta just experiment with it and play with it. All right, thank you.
Cut.